and welcome to this month's video newsletter. As you know, we recently rolled out our new electronic health record system, and the system was designed to increase hospital efficiency, staff productivity, and most importantly, effective patient care. Today, I wanted to talk to you more about the technology initiatives that the hospital will be implementing and focusing on in order to increase patient-centered care and get the patient more motivated and involved with their health goals. Firstly, we will be updating the patient portal in addition to the health records. So any test results, medications that are put into the patient chart on our end can be viewed by the patient once they are discharged. They can look up all health records, print them out, and have access to their chart if they ever needed to forward information to other doctors. In the system, you are also able to view any imaging. If you needed to update prescriptions, you can schedule and view appointments as well. I think this will help the gap with patients in terms of getting them in for their appointments and checkups and overall improving their care. Also, for any staff members who are directly dealing with patients, this is the nurses, physicians, make sure you're talking to patients about some of the new mobile technology. The hospital will be coming up with an application that'll be the mobile version of the patient portal, so you can view it on your phone as well as on the computer. With the rise of smartphones, there are many apps that can track nutrition, fitness, exercise, and you can even sign up for local fitness classes with some of these apps, and it's safe for their information. I would mention this to a lot of our patients. We know that some become very sedentary, and being able to track some goals might give them the motivation they need to be in a healthier track. Also talk to your patient. We will be looking at some new devices that can actually plug into phones in order to track like glucose for our diabetic patients, or even their Bluetooth blood pressure monitors that they can hook right up to their phones, and it can get sent right to an app, and it's easier for the patient to monitor those results for their upcoming doctor's appointment. On the exercise perspective, you could always recommend smartwatches or, of course, a Fitbit in order to track heart rate and step count to make sure that we're not sitting around too much throughout the day. That works well for you too as staff. We know we're all moving, but there could be times that we can be more active as well. And also, we should practice what we preach. That if a patient sees us wearing it, they might be more apt, and they might ask you a question about it, and you can tell them. The patient portal and the mobile technology, the mHealth, to be specific, puts the patient at front and center of their care. Like, they become the focus and they become more enabled. They might find themselves looking up more research on their diagnoses and wanting to become more involved instead of just, you're the doctor, I believe you. But just be sure to explain to them the information that they should be aware of. That means make sure that they're looking at .gov or .org sites and not just Wikipedia or WebMD. Make sure that they understand that they can believe everything they read. It just doesn't always pertain to them, and educate them on their diagnoses. And if they do find something, it may that they should ask questions about it and not just assume that they have it. Also, let your patients know, and friends and family, we will be involving more staff, hiring new staff in terms of marketing through social media. So we want to promote the hospital and the clinic and the events. So we will be getting on Facebook and Instagram. That way we can promote ourselves if we are getting involved in events, or if we're getting new equipment, things that might be beneficial to the local community. And it can get the patients more involved if they see that, we care, we're promoting ourselves and what we do. It might not seem like a hospital to them or just another institution. It becomes their family. And also just see the things that we're into. If they know that we're educating and bettering ourselves, that they could see us more apt and up to date with information instead of following old school procedures. Especially with up and coming doctors and nurses coming right out of school. So let me know if you have any other questions or things. If you want to get involved, I'd be happy to get you on a team in order to do the marketing with us. And also, if you have any specific technology that you're aware of with new research or currently use and are telling patients about, I'd love to promote it to everyone and make sure that everyone is aware of all of this with the knowledge so that everyone can be educated, ourselves and our patients. Because it's not just about mobility, it's about the connectivity. So the technology connects the patients and they can become more involved, but it also frees up some of our time as the providers so that we can connect with our patients, so we can more efficiently be able to access information on them and pull it up all in one spot instead of having to run around and actually have time to spend, which will help their care. When they see that we're invested in them, they want to invest in themselves. And these technology initiatives and making the ease of them tracking the results and not have to come into the clinic as frequently and being able to reach us will help their care, help them reach their goals more effectively. So I will look forward to meeting you all in upcoming meetings in the next couple months with training for the new system. Keep in mind any comments or concerns regarding social media, the patient portal, or any tracking devices or specific health apps that you enjoy. And we'll make sure that they're appropriate for all patients because we want to protect their information as well and don't want any violations, HIPAA violations getting out there, and make sure that everything is safe and we can protect them as well as us. And I hope you all have a great month, and I'll see you next month.